Hello, everyone. My name is Harsh Patel. I am a first-year student in the Masters of Athletic Training program at North Central College. Today, we'll be talking about the injury-related fear in the physically active patients who have sustained a anterior cruciate ligament known as the ACL injury. Joining me today is Dr. Shelby Baez. Dr. Baez is an assistant professor in the Department of Exercise and Sports Science at the University of North Carolina, Chapel Hill. She's a certified and licensed athletic trainer with an expertise in psychology and sport injury and an approved non-certified mentor for aspiring certified mental performance consultant through the Association for Applied Sports Psychology. Dr. Baez's research examines the impact of psychosocial factors in health outcomes after sport-related injury, with a focus on patients after ACL reconstruction, sorry. So, Dr. Baez, thank you for joining me today. I'm glad that you're here to talk about this topic.
Yeah, thank you so much for having me.
Yeah. So, first question I'd like to ask you is I would just want to start off broadly, and I want to ask you how you became interested in the topic area of psychology, fear, and knee injuries.
Yeah, that's one of my favorite questions to answer. And it really started when I was working clinically as an athletic trainer.
Mm-hmm.
I was just certified and I was working on women's soccer camp. And I go down to the field and it was pretty clear that this athlete tore ACL. And I
Okay.
start having the whole, I don't have MRI vision. Let's get you to see an orthopedic. And
Mm-hmm.
she just started listing off all her accolades to me, how she signed at XYZ University and held this national record and that national record. And at that time, I had absolutely no idea how to help her.
Mm-hmm.
I continued to see patients in a physical therapy clinic in the course of that next coming months. And I continued to recognize how factors like fear and motivation and confidence really impacted my patients and their ability to be successful in rehabilitation. But when I looked in the literature, there was substantially lack of evidence about what we could do to actually help patients from a biopsychosocial perspective.
Yeah. Okay. And what university were you working at?
At that time, I just finished my undergrad degree at the University of North Carolina in Chapel Hill, and I was working with a company called Active Care Physical Therapy. So this
Okay.
was prior to transitioning to get my post-professional master's in athletic training at the University of Kentucky.
Okay. So after that experience when, like you said, there wasn't that much experience with how to help athletes after an ACL injury, um, once you've gained that knowledge of that about that topic, can you give us like an overview of the injury-related fear and kinesiophobia and how that can affect physically active patients who sustain that injury?
Yeah, of course. So, injury related fear really is this broad term to help us understand the different types of fears that someone may experience after an
Mm-hmm.
injury. So, we can think about kinesiophobia as a specific type of injury related fear, which is a fear of movement
Yeah.
or fear of re-injury after some sort of injury. We can see fear of failure, we can see fear of pain, which would manifest as potentially fear avoidance beliefs. So there are a lot of different types of fears that we can see after an injury. One theoretical model that helps us to make sense of how fear might impact the recovery process is the fear avoidance model. What
Mm-hmm.
the fear avoidance model suggests is that when you have a painful experience, you can go into one or two pathways. You can have lower levels of fear, be able to confront your rehabilitation, and then have an adaptive recovery. However, if there's threatening information that is perceived by the patient, they may start to engage in catastrophizing behaviors. So, potentially magnifying that pain or that anxiety or that fear,
Mm-hmm.
feeling helpless about it, and potentially ruminating and thinking about it consistently, which can lead to the development of fear of pain or pain related anxiety that can then lead to disuse, disability, depression, followed by a series of chronic pain or potentially
Mm-hmm.
increasing the risk of having a second injury. But throughout the scope of the literature, we see that kinesiophobia, specifically that fear of movement, has been associated with decreases in self-reported function, deficits in jump landing biomechanics, as well as failure to go back to sport and engage in physical activity.
Yeah. Another thing what I've observed during my clinical experiences is that it's not just the ACL injury, but other injuries as well, where like how you talked about the fear avoidance theory, like how some go into that rough cycle and some are able to break through that. I have seen it myself, whereas they get injured and it's like there's time lost to it. So they're out for a pretty decent time in their season and they don't have that glimmer of hope that they'll be able to come back. Whereas on the other hand, I've seen where, oh, they have this like season-ending injury, but they are like, oh, okay, I'm ready. They're motivated to come back. Um, Between those two, what is more difficult to you? People like getting the unmotivated athlete to get motivated, or deem or like slow down someone who's already excited to come back?
That's a tough question because both of those have their own individual consequences.
Hmm.
I think the way that I like to kind of frame some of these psychological responses is along the lines of what you were just saying. So, like
Yeah,
favorable psychological responses, like
yeah.
high psychological readiness, high confidence, high motivation, as well as unfavorable psychological
Hmm.
responses, such as decreased psychological readiness, decreased confidence, kinesiophobia. So we can see that channeling some of those favorable responses can be helpful and adaptive. But
Hmm.
what's interesting is when we look in the literature, we can see that our overconfident athlete can also be at risk of sustaining another injury and potentially having a
Yeah,
poorer outcome.
yeah.
So I always recommend doing a full biopsychosocial screening on folks and really understanding where someone looks and how someone looks from a functional and biological standpoint can
Hmm.
help to really inform whether that increased motivation is potentially adaptive or maladaptive, or is that confidence actually representative of what the person can do functionally and physically. So I think that's one of the challenges in this space is that a lot of the work has really been done in isolation and looking at the psychological factors independently without really understanding full patient profiles to make sense of whether it's the more adherent, more motivated athlete, the more
Hmm.
confident athlete that we need to look at addressing, or if we only address really the unfavorable psychological responses that we may see, like kinesiophobia.
Yeah, yeah. It's very difficult when because you don't know what to expect when when you have an athlete come into rehab from an injury. They'll be like, oh, will they be motivated to do rehab, or will they be not motivated enough? So that's like the difficult part of this occupation. Um, so my next question for you is, based on your research and the overall body of knowledge, what strategies can an athletic trainer use to support patients who have sustained an ACL injury and are dealing with the psychological complexities of rehab and return to sport? So basically, how can we help them overcome their fear?
Yeah, there are a lot of different strategies and techniques that you could potentially integrate. The first thing I always recommend is making sure that we use appropriate outcome measures to
Hmm.
identify what type of psychological response that person
Hmm.
is having, because that may dictate decision making on what type of intervention you can use. I also recommend integrating techniques like motivational interviewing
Hmm.
to help motivate that athlete or that patient to potentially engage in a psychological intervention. So fundamentally, when someone has an injury and they have to start going to rehabilitation, that's a behavior change. And
Hmm.
sometimes folks may feel less motivated to engage in that behavior change. And this is the same concept here as after they're doing rehabilitation, now we have to tell them that they need to integrate a psychological skill. That's
Hmm.
also a behavior change. So using motivational interviewing to really express empathy and roll with resistance and really support that patient's autonomy and increase motivation for a psychological skill is something that I always recommend as a starting point. Now, after you get patient buy-in, depending on the type of psychological response, so I'll say fear of movement or kinesiophobia, my lab has really targeted this in two different ways.
Hmm.
With a fear of movement, we've used graded exposure therapy. And as athletic trainers, this is something that's really easy for us to implement Because rather than using like pain or soreness as the progressive factor, as we usually do in
Mhm.
rehabilitation, we use fear as the progressive factor to determine when to move someone to that next stage for maybe hopping or jumping or cutting.
Mhm.
Now, what we've also seen is that the graded exposure independently isn't super great at getting at some of those general phobic responses. So
Mhm.
we've also explored mindfulness meditation and how we can integrate that into rehabilitation. Because while it's great to expose people to simple movements like hopping, jumping, and cutting, sport is extraordinarily complex, and it's probably going to be hard for us to expose everyone to every single situation. So giving
Mhm.
them a tool like mindfulness where they don't become overwhelmed or judgmental about what they're feeling. They acknowledge the thought or that fear, but they don't allow that to dictate or change their attention, is something that I would also strongly recommend. So those are two strategies that we're currently using in the lab to try to address kinesiophobia specifically.
Okay. And I've seen that you've mentioned patient-reported article outcomes, and in one of your articles, it looked at psychological readiness, injury-related fear, and persistent knee symptoms after ACL reconstruction. You used the patient-reported outcomes like the ACL RSI and the Tampa scale. As we know, however, unfortunately, many athletic trainers do not implement patient-reported outcomes because of the time constraints and the lack of understanding of those PROs. How would you encourage current athletic trainers as well as future athletic trainers to use patient-reported outcome measures for their patients, especially for those who are working with an athlete that has suffered an ACL injury?
Yeah, getting the time barrier about patient-reported outcomes is consistently something that I know has been in conversation for at least the past 10 to 15 years in research and in clinical practice.
Hmm.
One of my arguments for integrating it and figuring out how to make the time for it is that some of these questionnaires can take less than 5 minutes to implement.
Hmm.
And we can also say that in order for us to truly treat the whole person, if we don't get the patient's perspective about where they're at and what they view from whether it's self-reported function or their psychological recovery, we're not going to ever be able to optimize our outcomes. So just like we prioritize implementing hop testing and implementing strength testing, we need to make sure we also prioritize and make the time to integrate a patient-reported outcome. And I also always like to say is that if you've ever given and asked a patient on a scale of 0 to 10, how much pain are you in today?
Hmm.
That is an example of a patient reported outcome that is being
Okay.
integrated. So that is one of the simplest ways that we've integrate PROs in our practice. So not every questionnaire is going to take 15, 20 minutes of time for a patient to implement, but it's definitely worth finding the right questionnaire for your patient population. After ACL reconstruction, we see the ACL RSI used quite a bit to look at emotions and confidence and risk appraisal in that general psychological readiness. And if you don't have the time to actually do it in the clinic, I would also recommend just sending the PRO home with the patient
Yeah.
so that you can have them implement it or complete it at some point in the process. Because if you're not able to get an understanding about their psychological readiness, you're missing a big component in their ability to effectively and safely go back to sport.
Hmm. Okay. And then would you also use the results from the patient-reported outcomes to determine, all right, this is a good time, like if they have fear of cutting, running, or change of direction, would that be the right time that would help you determine, okay, I need to do more rehab exercises that forces them to face their fear of running, cutting, and changing direction?
Yeah, you can use the PROs as a starting point to facilitate a conversation with a patient about their fear and saying,
Hmm.
"Hey, I saw that you scored an 8 out of 10 on this particular question. Let's talk about it." You can also use those questionnaires to see change over time. So let's say you want to implement a graded exposure, you can use that questionnaire to actually see, did my treatment actually work? Otherwise, it's really hard to gauge whether our treatments are working. It's the same idea with like using a goniometer to measure range of motion.
Hmm.
What we do this frequently throughout the process to see that we're getting better. And these questionnaires can be used the same way to see are patients getting better with the treatment that we are addressing, in this case, from a psychological perspective. The other piece here is that fear sometimes is actually a protective factor. So fear itself was designed to make sure that when we say saw that lion in the wilderness a long time ago, that we
Hmm.
knew to run away and we didn't have to think about all of these processes that would turn on the system to allow us to run away.
Yeah.
But as society became more complex and our
Hmm.
fears became more complex, sometimes what we're fearing is not actually a lion, but we're fearing something that may look like a lion but could be good for us.
Hmm.
Now, in the case of this ACL rehabilitation and reconstruction, we can see that patients who potentially have really poor functional outcomes, so poor strength and poor hopping, they probably should be a little fearful because they aren't at the functional capacity, which is why we
Hmm.
probably see a lot of patients have high levels of fear early on in that rehabilitation process because they shouldn't be cutting and they shouldn't be hopping. I'm actually more concerned for those patients who don't have fear early in that rehabilitation process. But the strategy there may be encouraging that patient to identify different techniques to not become overwhelmed with that fear. So maybe mindfulness early on in that process. Now, later on in the process, if someone is jumping and running and cutting the way that they need to, but they're scoring really, really low on their psychological readiness
Hmm.
questionnaire or a fear specific questionnaire, that may indicate that something like exposure therapy could be really beneficial to help that patient be able to
Hmm.
successfully return back to sport.
Yeah, and then once they overcome that fear, they gain that confidence and they're like, you know what? It's not so bad.
Exactly. We see that
Yeah.
relationship between fear and confidence.
Yeah.
Highly fearful people are probably not as confident, and
Hmm.
more confident people are less fearful.
Yeah. So with the knowledge in your studies that you have acquired, as well as because you have published a lot of articles talking about the biopsychosocial approach about uh, fear and kinesiophobia, are there still gaps in the knowledge that relate to this topic area in terms of ACL injury?
Yes, there are still significant gaps here. I think the scope of the literature is pretty clear that psychological responses matter and that we can see different types of psychological responses impacting outcomes. A lot of the literature has been specifically on kinesiophobia, but I do think we can consider other psychological factors, like thinking about motivation, like thinking about things like athletic identity, like
Hmm.
thinking about other psychological responses, resilience, and how that may impact someone's ability to successfully recover.
Hmm.
So I think broadening that scope of the literature would be helpful. But on the flip side, I think we see significant decreases in our ability to understand the trajectory of how these psychological responses are impacting outcomes because we don't have strong observational studies that really track
Hmm.
these psychological responses over time. And then additionally, we don't have a ton of rigorous research out there that is really implementing these different types of psychological skills trainings and cognitive behavioral techniques and acceptance and commitment approaches to really see what can impact our and facilitate an adaptive recovery after ACL reconstruction.
Okay, and then would you say that those gaps in knowledge is your goal for the next steps in your future research?
Definitely. Yeah, I think in the scope of where my work is going, right now we're
Mhm.
running two clinical trials that are really
Okay.
designed to try and get at that gap on what we can do. We have a couple of studies in review right now and grants in review that are hoping to get at some of that observational pieces. But one thing I always say is that I've used ACL as my model
Hmm.
to try and understand how these psychological responses are impacting outcomes. But I do think there's so many other patient populations that we can start to explore these things in. Rotator cuff patients, we're thinking patellofemoral pain, we're thinking chronic ankle instability. And I
Hmm.
see a lot of my work also going into some of those other places and using what we've learned in patients after ACL reconstruction to further characterize how those psychological responses may be impacting outcomes and what we can do to address that in other sport injury populations.
All right. So That is it for in terms of time. We're getting close there. I would like to say thank you for sharing your passionate insights on this important topic area. I know that my classmates and the other listeners will be able to take this conversation and apply it to their clinical practice. Last question I wanted to ask you is, do you have any advice to offer to the athletic training students as myself? As I'm wrapping my first year into the program, I'm always looking to learn from others.
Yeah, of course. My best piece of advice is to reach out to folks doing the things that you're interested in. A lot of
Mhm.
us are really open to wanting to mentor and collaborate and to share what we've learned along the way. So don't be afraid to touch base with us at conferences via email and see how we can connect. The other piece of advice I would say is that uh, don't be afraid to go through doors that open for you. I was fortunate that the doors open that I could be trained as a sports psychology professional and mental performance consultant.
Mhm.
But it was a door that I could have said no to. But really weighing the options and seeing how the doors open and going through those doors when it feels right. Um, so say yes to more opportunities than you say
Mhm.
no to along the way.
Okay. Yeah, our professors really drill that into our holes to get us out of our comfort zone. Well, besides that, is there anything that you would like to promote, whether it be social media accounts, your website, articles, anything?
I will say that if you're interested in this, Dr. Kate Jacobson and I wrote a paper in the Journal of Athletic Training on psychologically informed practice for sport related injuries, where we
Hmm.
outline different psychological assessments as well as different psychological interventions that athletic trainers can use to enhance their practice. So if you're looking for a starting point in trying to get into this space, I highly recommend that article.
Okay. Well, thank you, Dr. Baez, for joining me today and sharing your time. Um, it was there was a lot of things that I've learned from you, and I'm willing to incorporate it into my clinical practice as well.
Awesome. Thank you so much for having me.